Now, it's generally assumed that measles, a dangerous disease that is life-threatening, is pretty much a thing of the past. It isn't. The number of cases in England is rising. Between January and the beginning of July, there were 738 confirmed cases compared with 247 in the whole of last year. The World Health Organization says incidence has risen significantly across Europe. In 2017, there were 21,000 cases and 35 deaths. Doctors and public health agencies are urging that people should be vaccinated against the disease. Well, Florence Weston is the business manager at the Eastern Church of England Academy in Bristol, where they've recently had 9 cases of pupils with measles. Dr. Lily Lamb from the Royal College of General Practitioners joins us from Newcastle. Lily, which areas in the UK are worst affected?
Hi Jenny. So in the UK we're seeing that in London particularly there have been high levels of cases, 262 since January, and then the southeast of England as well with 154 cases, less cases in the north.
Why is it happening?
So really it's happening because people haven't been vaccinated. We know in Europe that there are low levels of uptake of the very effective vaccination that's available for measles, and that's led to outbreaks in Europe. And then people in the UK who haven't had their vaccine when they were children are travelling to Europe, potentially picking up the infection and bringing it back to this country. So though we have very good levels now in our under 5 population where they are being vaccinated, we know that there's a group of young people, potentially between 15 and 25, who didn't have the vaccine as children, and they're very susceptible to the infection.
Florence, you've had such a high number of cases within one school, 9 children. Why do you think it's happened there?
We're probably quite an atypical school. We have a lot of children who are new to the UK, or certainly their parents are new to the UK. So the vaccination levels were slightly patchy. We made a presumption that there were low levels of vaccination among children, but we were actually proved wrong when we started looking into it. But there were very low levels of vaccination among the adult population in our community.
Now, why is that among the adult population? Is that because they're people who've come in, or are they people who, we didn't have a measles vaccine until 1968, who never had it when they were kids?
In our area of Bristol, we are a school with about 70% Somali cohort, and our parents do tend to have come to the UK not in childhood, so they may have come through other countries, they may have incomplete vaccination records, they may have arrived as adults. Our children in general who are born here do have average vaccination rates, we found.
How ill did the children who got the measles become?
It wasn't too severe, I don't think. Most of them were back within school within sort of 10 to 14 days after their illness. The issue we had was children with lots of siblings. We had to exclude non-vaccinated siblings for 21 days to ensure that they didn't come back into school when they could have been contagious.
How contagious, Lily, is it? Does it really spread like wildfire?
It's very contagious. It's spread in the air. So if someone with measles sneezes or coughs near to you and you haven't been vaccinated, then you are at risk of contracting it. If someone sneezes on a table, say, that virus can live there for a couple of hours. So if you then touch that and then touch your face, you can contract measles in that way. So it's very contagious.
Now, if you are a person who's older and didn't have the vaccine because it didn't exist, and maybe had the disease, are you then immune?
You should be immune, yes.
But why is it such a dangerous disease?
So it's a very dangerous disease because it can be fatal. It's rare, but it can be fatal. And we know that in the year before the vaccine was introduced, there were 99 deaths in the UK. It's particularly dangerous for people who are under 1, or pregnant women, or people whose immune systems aren't working in a normal way, for example, if they're on chemotherapy. In the majority of people, it will be a fairly nasty but self-limiting illness that lasts, 10 days. But it can lead to nasty complications such as something called encephalitis, which is inflammation and infection in the brain. It can cause pneumonia and, as I said, can be fatal.
What are the symptoms as it's beginning?
So most people will catch the infection and won't know about it immediately. So there's an incubation period usually of about 10 days. And then people will tend to get symptoms of a cold, a cough. They might get conjunctivitis, so inflammation in their eyes, and a high temperature. And that usually lasts about 4 days before they get the rash. The rash tends to start on the face and then spread to the ears and down the body. And it's a bright red, nasty rash that they experience, and that lasts usually up to a week before they start to get better.
Florence, how open did you find parents in the school were to getting vaccinated and making sure their children are vaccinated?
Well, we were concerned because there are misconceptions about the link between discredited misconceptions about the link between the MMR vaccine and autism, which has been raised in our community as a concern. So when we were initially talking to Public Health England about the outbreak, we decided that we thought a public vaccination clinic in the school would be a very good idea, but that had to be coupled with a public meeting to allow them to talk to public health officials about their concerns and to waylay some of those fears. And actually, once we'd had that meeting, which was very well attended, we held our first vaccination clinic and we were able to vaccinate about 196 individuals over the course of a day and a half.
What about the teachers? Because I understand half of them had not been vaccinated.
Yes, I don't think it was as many as half, but we did find that obviously our teachers, we did suggest that anyone who was unsure of their immunity went and got it checked. And we found that teachers who were slightly older hadn't had the vaccination necessarily, and also some of our younger teachers were also not immune. We had pregnant teachers who we had to exclude from the school for the duration of the outbreak. We also had teachers who were potentially immunocompromised. So in terms of staffing, it was a significant issue. And most of the staff who found that they were not vaccinated were very, very happy to get vaccinated immediately.
Lily, there has been, as Florence said, doubts expressed about having the MMR vaccine, which is measles, mumps and rubella. What advice do you give to parents who resist vaccination?
So the advice I would give is that it's a very safe, very effective vaccine. The consequences of measles infection are potentially huge. It's much, much safer to get your child vaccinated, and we as a Royal College would strongly endorse that every parent ensures that their child has that vaccine, and if they have a teenager or a young person who hasn't had it, they seek that vaccine through their practice.
And what about people who might be going abroad on holiday shortly?
Yeah, absolutely. That should be a consideration as you make your travel plans. Do you have all the vaccines you need? And MMR should be something that's considered. If you haven't had it, you can organise that through the practice. It's available free of charge for everyone. You require 2 doses of the vaccine to have immunity to the infection, but that's very easily organised through the practice. And
could GPs maybe be sending out letters to say to people, might be a good idea to get vaccinated?
Yeah, so GPs through their contract aren't officially allowed to write to their unvaccinated population. We rely on the campaigns that are coming down from Public Health England, or the posters that are being put up in waiting rooms and messages on TV screens, really to trigger people to think, am I immune? Am I certain I'm immune? If not, to ask the practice nurse, and they have records of everyone's vaccination history and can find out.
What percentage, Lily, of the population needs to be vaccinated to create herd immunity?
So the WHO target is 95%. And we're currently achieving that, but the problem is that wasn't being achieved in the early 2000s. It dropped to about 80%, and that's the cohort that we're seeing, these 15 to 25-year-olds who are at high risk, particularly if they're going abroad to music festivals, for example, where they're in close contact with other people who may have the illness but don't realise it.
Florence, I know you've got another clinic at the school next week. What are you expecting the uptake on vaccination to be there?
I'm hoping that the people who came and had their first dose will be coming back. So of that 196, the majority of them were actually adults from the community who hadn't had the vaccination at all. So on Thursday the 12th, we have got Public Health England back in with the screening and immunology service. And I hope the uptake will be similar to the last time.
Florence Weston and Dr. Lily Lamb, thank you both very much indeed for being with us.